Assalamu alaikum wa rahmatullahi wa barakatuhu. Today, our episode 5 with Marian Ahmed. And Marian Ahmed, welcome to our podcast. And today's topic is about mental health awareness and treatment services in Louisville, or the resources we have for our mental health program. So, Marian, welcome. And can you say hi to our audience?
Yes. Wa alaikum salam wa rahmatullahi wa barakatuh. So excited to be back.
MashaAllah, that's good. So, Marian, for the audience, who's Marian and why are you in this field? What motivates you to be licensed clinical social worker?
Yeah. My name is Marian. I am a licensed clinical social worker. What motivated me to be in this field, really? A lot of things, really.
Okay.
Specifically, what motivated me to be in our community, within our dean, trying to provide services is because really I want people that look like me, people that sort of have similar life experiences to be able to have an outlet to get help. That's really what I'm passionate about. In terms of social work in general, I've always sort of been of the helping nature. So it just kind of fit my personality, really.
Wow, that's amazing. And tell us about your background, where you're from originally.
Yeah, so I'm originally from really similar backgrounds to a lot of Somali people. I'm Somali. I grew up in Kenya. I came to the U.S. when I was 9 and have been here ever since.
Wow. So this is home. Louisville is home, huh?
Yes, Louisville is home, alhamdulillah. Love it.
Okay. And, again, my name is Farhan, and I'm the executive director of the Somali Community Center. So Marian, she is, amazing, mashallah, phenomenal, and she's part of our team. She is the case manager and, licensed social clinical worker for our community. Marian, what are you thinking when it comes to working at the Somali Center, supporting people from your community?
Yeah.
And how does it feel like, tell us what makes it that so, interesting for you?
Well, it's very different from, I have to say, first of all, alhamdulillah, probably one of my most rewarding positions that I've had. Just to be able to walk into a room and be providing some sort of mental health assistance, or just to talk about mental health with kids that look exactly like me, I think that definitely is rewarding in and of itself, number one. And the other thing is that I've never really had a position like this, right? Like all the other places that I've worked, it's always been sort of maybe in another nonprofit, or I've worked in the hospital, and really just providing services to the larger community. And it never included Somali people, sadly. And not necessarily saying that they weren't inclusive, but I think our community just doesn't know what's out there. So I've never really had another Somali kid in therapy, or really had the chance to talk to them about mental health until now.
Wow. And so do the Somali kids more open talking to you when it comes to this topic? Because you do workshops and going out to community, going to different places. What is one thing you catch up from working with, general community than working with specifically Somali kids?
Yeah, I don't know who gets more excited. I think I'm the one who's more excited when I walk into these spaces. So we've been to sort of madrasas and duksis to have these sort of conversations and provide psychoeducation to kids. And I'm probably the one that's more excited, but they get really excited. Like, I come in with my hijab and my abaya on, and they're like, really? Like, this is what you want to have a conversation with us about? And I'm like, yeah, this is what I want to have a conversation about.
Wow. Yeah, they can relate to you.
And they're so smart. They're not necessarily this new generation of kids. They know a lot about mental health. So just giving them that opportunity to just open up and have that conversation, and then provide them with sort of more realistic facts about mental health, not necessarily what they're only getting off of the internet. I think that's really helpful, but then also just giving them the space to have a conversation about it. I think that's been really helpful too. And they just respond so well to it. They're just like so open and real friendly kids.
Wow.
Alhamdulillah.
Alhamdulillah, that's amazing. We didn't have this type of services 10, 15 years ago.
We sure didn't. Nobody had this conversation with us.
I see. And one thing I remember when I asked you about this opportunity, when I presented to you, you did not hesitate for a minute. And that tells me how passionate and you wanted to help for the community. I want to say thank you. We will do anything possible to support what you're doing. And we also asking the public to support Marian and say thanks to what she's doing. So Marian, when it comes to mental health, our community, we have, this stigma taboo. Our goal was to go out. When I was thinking about this program, we said, let's educate the community first before we even go out and tell them go for treatment, right? So think about the education part. Was that the right thing we did? Going just first, do the workshops about what is mental health. Like just talk about that. What do you think?
I think it's definitely the right choice. I think any sort of community related sort of event has to have a face, right? Like we have to know who we're talking to.
Right.
So I think going out, really, we've been heavily in the Duxis, right?
Yes.
So in these madrasas, now I can really pick out like, oh, I recognize that kid from this Duxi, or I recognize this kid from that Duxi, and they recognize me, from being part of the Somali community of Louisville. So I think putting a face to the people that we're serving, number one, I think that it's been helpful in that manner. So I think it definitely was the right way to do it.
Okay, that's great. And also we did some, Facebook Live, which is also engagement to the community. They see your face, they hear us speaking Somali, and that also relates, right? But it's always about talking about it. I mean, at this moment, we've been doing this for a year, and my results, what I see is people are started coming out and talk about this. It's starting coming to become more comfortable talking about it. That's the key. That's my goal, is at least we can discuss in the mosque, in the community centers, going to different places, going to different neighborhoods. Like we went to Carpenter apartment last weekend, and it was amazing for us to have a conversation with elders and people in the community, young adults, all of them. They did not hesitate to speak about mental health, and that shows progress for our community we made.
Inshallah.
Yeah. So tell us a little bit about how Somali Community Mental Health Program works. So it's more like workshop. What else going in? Show me the layout.
Yeah, I think this first phase, we've really been heavily in the workshop sort of sector. We've been just providing a lot of psychoeducation, and really the point of it is not just to educate them, but for them to get comfortable with us, right? Like, because we have so much stigma around mental health in our community, and this is really the first time where we're taking a big stab at it. Getting them to sort of trust us has been a big thing. And inshallah, we'll keep working at it, trying to earn people's trust so that they know that, the delicate stuff that they're coming to us with is not necessarily going to go somewhere else. So,
awesome.
Yeah.
I mean, I seen it too. The younger generation, they're accepting more than the elder generation. The older generation. But mostly when I speak with them, in public or privately, they tend to listen. They tend to learn, and that itself is a win for them to give you attention about mental health. Because what happened during the COVID, we had so many suicides in our community. We have so many overdose, gun violence, and when we track back, why is this happening? It's because of mental health, So that's what is the root cause of, overdose. Kentucky is the second in the nation when it comes to overdose. So that itself tells you we are also affected. Think about that. Like, so what is you saying about how we are the second largest, in the state when it comes to overdose and mental health?
Yeah. It's sad. I think Louisville as a whole has a lot of sort of initiatives going on when it comes to substance abuse treatment, and I think our community is not necessarily getting that. So that's really kind of sad, and hopefully we can bridge that gap between what the state is offering and what the city is offering in terms of helping people that are struggling with chemical dependency. And what our community needs to be getting as well, because we're not immune to it, right? Like we make a big majority of what the Louisville population is. So to think that it's not necessarily touching us, I think that's very, it's not true. It's touching us. I think everybody at this point either knows somebody that struggles with chemical dependency, maybe they have it in their own family. You know, it's hard. It's hard on the person that's using. It's also hard on the family members, right, of the person that's using. Correct. So I think it's something that we definitely have to have conversations about, so that we can save our siblings, we can save our loved ones, right?
Correct. I mean, I know, I will say pretty much every family that I work with, there's someone in the family that, you know, needs mental health services, whether it is, you know, substance abuse, you know, alcohol abuse, or, as you said, chemical dependency, or, you know, mental health, because we come with so many traumas coming from a war country, Somalia. We been to different countries as a refugee. That itself is a trauma. Coming to America itself, you know, you have to be part of the society that you've never been, so you also have to get used to. All these things come in a heavy way, and that's why my passion is to have more awareness and have more access to the community, like how we have different agencies that we community partners like DDM, Peace Hospital, 7 counties, to talk to them about mental health and how we can advocate for the community and how they can provide the services that they do have. So when someone in our community needs help and they feel like they have mental health issues, so they call you, right? So can you a little bit explain that process? Is how do you help them, or how do you get them to the right resources? Can you speak about that a little bit?
Yeah, so we do have a phone line strictly connected to the Somali community of Louisville, and then it comes straight to me, and it is our resource line. I encourage everybody to use it. I'm very friendly. And it's whatever you need. So if a parent is calling for their kid, you know, we'll assess what level of care they need, and then connect them to that level of care. If you're calling for yourself, same thing, right? Whatever it is that you need in that moment, depending on what's going on with you. If you need, you know, crisis services, we can connect you to crisis services. If you need SUD services, we'll connect you to that. If you need just, you know, standard outpatient therapy where you go once a week, once every other week, whatever you need, we'll connect you to that. So really we'll assess, you know, we'll have a conversation, get to know each other, we'll assess your needs, and then we'll connect you to where you want to go. Great.
I mean, that's why one of my goals is to have accessibility for any services, whether it's mental health, whether it is housing, education.
Exactly. And we'll, you know, I'll definitely make sure, I don't want anybody to think that they're going to call and then I'll just tell them where to go and then that's the end of it. But we'll definitely, you know, if you want help with scheduling your first appointment, if you want to make sure that your insurance takes that person, we'll do all of that work for you. You just have to sort of call us.
Yes, I mean, like, we also know what type of medical insurance you have. Like, if you have Medicaid, we know who to refer, we know who to work with. And also, we make sure that you are getting taken care of. Like, when we send you to an agency, we follow up. We make sure that you're getting transportation, you're getting interpretation. We do a follow-up. Like, we have one of our clients who we did, and when I call him a few days, he didn't have his medication, so I have to call the pharmacy, I have to call the provider, make sure that these people need their information, and that's why we are here, you know?
Yeah. It's not easy, you know. I think regardless of, I think for our community, there's obviously an extra layer of like culturally specific programming that we would want for them to have that makes it a little bit harder. But it's really not easy for anybody getting started in this mental health world, right? Yes. You know, you have to go through your own anxiety, get through that, and then once you attend that first appointment, you know, it might not be with somebody that you like, or it just takes a while to get to know somebody so that you can tell them all of these private things that you want to tell them. But we'll definitely walk you through that process. We'll do a lot of encouraging, because at the end of the day, what we want is for our community to be getting the help that they need.
Awesome. That's great, Marian. And I want to say thank you for this opportunity, Marian. Thank you for what you're doing. make sure you take care of your mental health as well.
Absolutely.
Yes, and we are here for the community. We are trying our best to share, the resources that the city or the state provides to our community, and that's why we, as you said, we're bridging the gaps that are missing. But if you want to call us, call that number. We will put it on the video. You will have the number, or you can Google Somali Community of Louisville when you call the number, and it will direct you to Marian if you select the right number. So, Marian, what is the last thing you want to add to this about mental health? What should we do when it comes to mental health in general? It's hard, but
that's not an easy question.
Yeah, give us.
What I will leave everybody with is, come to us. Mm-hmm. Really, now there's a specific sort of physical place that you can come to. I do have open office hours every single Tuesday between 6:30 and 8 p.m. Mm-hmm. So you'll see me here. You could come have a conversation with me, come have some tea with me, whatever you like. Mm-hmm. Just come to us and let us know what you need, and we'll definitely connect you to the services that are available to you.
Yes, that's amazing. Yeah, every Tuesday between, you say 5, was it?
6:30 and 8.
6:30 to 8, yeah. So you can come in. It's a walk-in. You don't have to set up an appointment.
Not at all.
Yeah, we have enough space to keep people waiting if you want. It's very privacy. You can come in, and it's very, safe place you can come to. And also on Saturday, November 25th. So we have an event for ladies only, young 16 to 24, right? And they can come in. We have a lunch for the Somali Community Center. If you come through on Saturday at 2 p.m., we are having an open, lunch discussion about mental health. We will talk about things that we provide, and we will discuss and listen. Right, Marian?
Yeah, come. We'll have some good food.
Yes.
We'll have something great to drink, and then we'll have a great conversation.
Amazing. You can come in always. Thank you, Marian, for what you're doing again. Assalamu alaikum.